Today's guest is Dr. Brian Waters. Dr. Waters completed his undergraduate studies at Ball State University with a Bachelor of Science in Pre-Medicine and Exercise Science, and also graduated from the Honors College at Ball State with a focus in humanities. He recently completed his Master's in Sports Science and Rehab from Logan University. He has his doctorate of chiropractic degree from Logan College of Chiropractic. He also is a certified provider of active release techniques, and he has been the lead ART team lead at the Ironman Muncie since 2012. He's also a lectured acupuncturist and can practice medical acupuncture and dry needling. That's not it, folks. He also is the National Strength and Conditioning Associate Certified Strength and Conditioning Specialist and has trained many athletes over his time. And last but not least, he is a amazing bodybuilder. He's won some things here in Indianapolis. Every time I go to try to work with him, he makes me feel rather small and puny, like I don't even lift weights. So
I can't
Dr.
swim.
Waters, how are you today?
Doing well. Thanks for having me, Chris. Appreciate it. Coach. That's your first name.
Yeah, you can call me Coach Chris, whatever you want. But yeah, I appreciate you going on. I don't know when I first met you, was it probably around 14 or 15? And I was having some back issues. And man, I think in a few months you fixed me up, and then I've been going back to you since. So, you do amazing things. How did you originally get started in this, your willingness to go down this road? What fascinates you or keeps you coming back, or what brought you to this?
Yeah, so originally I wanted to be an orthopedic surgeon, and then found out I shadowed a few and I didn't like blood, just couldn't deal with it. They're like, well, it's probably good that you found this out now. I was like, yeah. My mom was in the pharmacy kind of situation, so she was always in medical stuff. So I always had an interest in the medical kind of world. And then I looked at PT, and at the time, this is 15, 16 years ago, there wasn't a good scope. So what I mean by scope is you were kind of restricted, and they kind of are still restricted to a certain extent. And so I wanted to broaden what I could do. And I was really good friends with a pediatrician at the time. And he said, just go to chiropractic school. You can do what you want after that. In Indiana, you're a licensed physician, so you can order imaging, prescribe rehab, do all the things that you need to be able to do. And at the time I was getting into fitness and things like that. So it kind of just made sense. Can I mesh orthopedic stuff with training? And at the time I was doing some strength coaching and getting my certification. It just made sense. Everything kind of came together, and basically all that stuff that was a great introduction. Thank you. All that means is I can speak different languages and try to, talk to different coaches, providers, parents, kids, athletes, and kind of make sure everybody's together kind of in a team approach. Cause I think that's even more important now with, we think technology makes things easier, but communication between providers, between coaches, between providers and coaches, between teammates, players, athletes, and the coaches and the provide, it's just a mess. So I try to help communicate all that together, or transmit that to each, just do my job. But anyway, all that to say that chiropractic school is kind of the route to get there. So I'm lucky, I had good mentors growing up, and they kind of pushed me in that direction. And then you just make it what you want, figure out how you want to practice, and just get after it.
Yeah. And, I think it's interesting that, you come from such a variety of background in your worlds, right? All the things that you do, because when I go to see you, sometimes it's acupuncture, sometimes it's ART, you throw some chiropractic in there. I always feel like you're going to come at it from a variety of ways to help me. And I know the athletes that have gone to you help you. And I know David Epstein, I think that's his name, wrote a book called Range. And the whole idea of the book was we solve bigger problems by not being so specific, but be more of a generalist. And your idea of coming at it from the strength perspective, coming at it from the chiropractic, coming from the ART, the acupuncture, so when someone comes to you, you're just pulling from all these different areas. And how does that work for you? Are you just oh, you're spotting it better now, or how does that work?
Yeah, that's actually a really good question. It's kind of, I guess, like coaching too. The more you see it, and the more you're saying, okay, I see this in this athlete, let's nurture that with this exercise or this different stroke pattern or whatever, it pushes them to this other place that you've seen hundreds and hundreds, maybe thousands of times. So I guess, in the beginning, you have these algorithms you learn in school with if this, then that. And then in practice, it's called evidence-based practice, where you take research, patient preference, and then your experience and mesh it all together. And then you come up with these algorithms in your head, and then you just practice them over time. So, in a low back case that comes in, they say, low back, depending on their history, 80% of the diagnosis comes from the history. You come in, you tell me exactly what I need to do. I need to know and do. You just don't know it sometimes. And then, people like yourself, you come in, you say, hey, I've tried this, this, and this. Well, that narrows that funnel down for me. And I love that. I love the Google Doctor stuff. I come in with as much information as you can give me. And then using all my different pieces, like, okay, in this specific case that happened this specific way, like you've been over in the morning to pick something up. It was you're tying your tennis shoe or something like that. Now you have nerve pain shooting down your legs. We're going to throw some orthopedic tests at it. And then, in this case, 90% of the time they respond to dry needling with electroacupuncture, ART to the dorsosacral ligament, stretch the psoas, give them the McKenzie disc, exercise. I have all this recipe in my head for that specific instance. And it's just taken, and I'm not an expert yet. I mean, I hope eventually one day I'll be an expert, and then I'll probably retire the next day. But it's like you just keep accumulating, be a learn-it-all, accumulating algorithms and what works for certain situations. But again, everybody's different. Human bodies are weird, especially athletes, as far as how they respond to different treatments. And it comes down to patient preference. So if I want to needle you and you hate needles, I can't do it because it's not going to work.
Yeah. Yeah, well, I had never done it, and I'm kind of afraid of needles too. But I know it made me feel better, and they didn't really hurt at all. So,
and a couple
times you stuck me, it hurt.
Most people like the needles more than they like my thumb or a Graston tool. So,
yeah, the Graston tool is a whole nother. Yeah, so obviously in swimming we have, I think at Carmel we try to do a good job of not getting injuries, but inevitably when you're in high level sport, it's inevitable. So when you do see a swimmer, what are the common things that you see, and how do you work with them on it?
So I'll sum this up and I'll say pre-Chris and post-Chris.
Okay.
So pre-Coach Chris here, Coach Plum, I saw a lot of shoulder injuries. I saw a lot of just repetitive use. They didn't have a lot of dry land training under their belt. Now, since I've met you and kind of seen how you do things, and we honestly, from you guys, we don't see a lot of shoulders. We don't see a lot of repetitive use. With swimmers nowadays, I see a lot of stuff, maybe more from like the weight room aspect. So, swimmers are really good at swimming. Maybe they have some discrepancies in their squat or which again, I know you guys are really good at picking up on that. And I don't see very many injuries, knock on wood, from your team, but just in general, we're seeing a lot more because a lot of people are lifting now in swimming, and maybe thanks to you. And you start to see these successes and these success stories, and you say, what are you doing? And they say, well, we're lifting weights. And they're like, what? So anyway, a lot of times it's just maybe, they lifted something too heavy, too fast, too often. And so usually just strain sprains in low back, strain sprains, maybe in calf, strains and maybe in shoulder, but it's going to be from an overhead type movement. And maybe they don't have business to be there yet because, they don't have thoracic extension or rotation. So there's a lot of different factors, but a lot of times it's not the typical stuff we used to see, which was a lot of rotator cuff. Because I feel like you guys are great at catching that early and handling it soon and fast. It's more like just maybe they twisted their ankle walking to class or something, or so it's actually a lot more outside of that. But as far as repetitive stuff, we don't see it as much. We see more, low backs, maybe just from something they're doing outside of the swimming.
And overall today, I mean, I know you deal with all the sports across. I'm sure you see soccer, cross country, whatever, basketball. Are there injuries that you see commonly with youth versus the adults? And is there a pattern in the younger people today that maybe we need to recognize? Because I think generally we're not doing as much PE as we used to. Mm-hmm. And I don't know if there's that getting to a place where we're maybe injured in one spot. And then also with the adults, are there certain things you're seeing again and again and again?
So do you want me to say specific to swimming or just in general?
Just in general, with all that younger athletes you see.
Yeah, my beef, and most people that know me know my beef with young athletes committing to a sport early on, which I know in this day and age, you almost have to. And that's why it's so much more important with their lifting and their other aspects of their training that goes into that sport. But they specialize too soon.
Mm-hmm.
A lot of times I like an athlete to do different sports, throw a ball, kick a ball, swim, jump, run, do all these different things to keep them kind of in a balanced, not overused system until they're, 12. Now, people on the other end of this are going to go 12. They need to specialize at 6.
Yeah.
So I think with kids, it's a lot harder because, I was a kid there, we did 3 sports. You did track, so you wouldn't get fat for football or wrestling. I mean, it's like you did one sport to help the other, but then you were good at this, and then it's balanced. And again, I think we're finding ways around that, but at the end of the day, the seasons, there's, you have high school season, but like clubs all year. I mean, you get a week or maybe 2 off a year, but same with baseball, especially baseball, football, especially football. And that's where we have to start watching these pitch counts and the amount of contact hours they have with coaches and all these things. They're just getting so much. Now with adults, it's the kids turn into adults. So the ones that are, they're doing some sports, if they never stop, they're pretty good. Like I'll see mid-30s football players, NFL, and they're doing pretty good. They have these tweaks. They're more tendinous. They get to be like high hamstring pulls, chronic ankle twists, or there's certain things that catch up to them. But I think a good example for an older athlete, what I see is they've practiced sitting at a desk for 30 years. So if they want to CrossFit, let's say, and they've sat at a desk, kind of like this, and
shoulders hunched, right?
Yeah, and it's comfortable. It's not, I wouldn't call it bad posture. It's just not perfect. But if you sit like this 8 hours a day, and then you expect to get your arms overhead in a lift, if you practice that for 30 years, it's not going to be. And they always say, "I'm getting old. I can't do this." No, you just haven't practiced it for 30 years. Right. But you can't expect to not practice something for 30 years, and then go, "Oh, I can lift 200 pounds over my head in a perfect overhead squat." And that's why it's so important to never stop that stuff. So I think adults, and I don't want to say ego plays a role, but they think they should be able to do something that they haven't practiced in 30 years when they've been practicing sitting or other things. But outside of that, it's tendons for adults.
Tendons. So let's say you are, you're 40 years old, you haven't done your sport or done a whole lot in 10 years. How would you tell them to start today? Like, where would you tell them to begin so that they could maybe CrossFit or run or, hey, they wanted to go, do pickleball. What would you tell them to go do to help prepare them for sport again at 40? To contrast maybe that sitting around all day.
So again, I have to meet them somewhere in the middle, and that's where, history, to sit down with the person. Okay, what have you been doing? Do you take walks every night? Do you walk? What was your activity level? What's your diet look like? I think that's huge. Activity level and diet. If they've maintained like for instance, if you've maintained a great diet and activity level, you can pretty much cross over different sports and do different things. If you want to CrossFit, if you want to play some soccer, if you want to do some swimming, if you have a groundwork kind of laid already. But I think that's the biggest thing is like, hey, let's get you doing normal things comfortably. Like if they're 350 pounds, no offense to that, that's fine. You got to start somewhere. I'm not going to make you run and do jumping stuff. Not right now. But if we need to make them feel excited about it, then we'll maybe throw some stuff in there, but you have to start maybe walking and start on diet. So there's a lot of other factors at 40 than there were at 15, even though we're seeing that creep down to maybe the 15-year-old that has never done anything and maybe is a little bit overweight. So we have to kind of play with that. But yeah, I have to meet them somewhere. Where's your level? If you're starting from scratch, I need you to walk every day this week, 15, 20 minutes, make sure you're getting enough protein, drink water, get them almost reset. Their hardware may be good, but their software needs an update. And then, give it a couple weeks and just kind of see where they're at and then say, okay, today I want you to do, do you know what a burpee is or a jumping jack or a box jump or maybe just an air squat, body weight, start with body weight stuff, get their joints moving, see what their mobility is, screen them, do SFMA, I do that, or FMS, or just watch them move. hey, can you squat for me? Oh, you really need to work on the squat because that's the foundation for everything in CrossFit. Can you reach overhead with one arm? Can you reach overhead with two? Can you rotate? Just kind of meet them where they are, and then based on that, create a plan going forward. But based on where they're at and then where they want to be. So, if they want to be a competitive CrossFitter at 40 and they've never done anything, then we have to talk about, well, is this realistic? And you can get there. I've seen it.
Right.
But, we have to create that plan. And that's very specific to the person. But really, for me, it's diet and base level activity.
Yeah. And I think that's a great place to start because, just basically get out there and move and walk and eat right. And that's a great place to start. And, you talked about meet them where they are. And I just think you have an incredible bedside manner. So, how did you develop that?
I've been thinking about this. We talked about this earlier a little bit. When I was in college, well, so some people just have it, right? I was always shy. I've got so many stories. I was super shy, never really talked. I was the good kid that got straight A's that just was quiet and sat there. And so it was hard for me to like get good at talking and being friendly and, well, not friendly, but you know what I mean?
Yeah.
I think personal training, when I was like freshman in college, I started personal training at the YMCA or at the Ball State. I forget which one was first. And I think forcing myself to talk to strangers in that way, like coming up to somebody at the gym. And so like really just being at the gym and talking to strangers, but then, hey, do you want to work out with me? That kind of stuff, like getting in a uncomfortable situation. But it was awkward. And then, like I remember when I was going to med school, they were wanting people with good bedside manner versus the smart person. Like they're like, we can teach you all the things you need to know to be an orthopedic surgeon, but we need you to be good talking to people. And so they wanted you to be balanced. So I think like school was really helpful in that. With college, I had humanities courses where we were talking about, you just get used to talking with people. But I mean, when I mentor kids and like, they're really shy and I'm like, I've been there. Like, I think I faked it till I made it at a certain point. Like you fake it till you make it. And then I was like, no, this isn't me. I'm being too like uptight and professional. Just need to be me. So I think at the end of the day, once you have that groundwork and knowledge and you're just you, I think the bedside manner comes out. But I have had several friends that they go through med school and I'm like, so why didn't you do your residency? And they're like, I just don't like people. so like, if you don't like people, you're not maybe going to have a great bedside manner. But I appreciate that though. Like it is something that when people come in, they're in pain. So I always think of like this. Right. People come in, it could be the worst day of their life. And I say that like they're in the most pain they've ever had physically and emotionally, mentally. I'm not dealing with that part really, but physically they come in their worst pain of their life. I need to make them more comfortable, whether that's me, making fun of myself for being goofy, or I play silly music sometimes, or just laugh and like make them laugh. And like, so part of it is just like make that person better than they were when they came in. Even if I can't take their pain away 100%, know that, maybe them thinking about me, oh, this professional, doctor, he's actually, we can hang out and drink a beer sometime, and just be goofy. And, I think it takes their mind off the pain a little bit. So anyway, two things. One, I guess you either have it or you don't, or you can practice it being in uncomfortable situations, but then knowing kind of, okay, this patient is in a lot of pain. Let's just get them comfortable and just, be more human.
Well,
did I answer it?
No, that's a great answer. It's true. Cause I lived it. And I know the people that talk to you rave about you. And I see a lot of people, especially young people today. They're like, yeah, if I go to school, if I get good grades, if I do all these things, I'm just going to go be successful. But there's such a human side. Like, no, you need to also have this connection and work on your soft skills, because that's almost more important than the intellect that comes with it. And I see it with young coaches too. It's like you just have to go be your authentic self, and you have to feel confident in that, and you have to expose yourself, and it's not going to go well every time. And it sounds like you were like, exposure therapy. I'm going to put myself through this, and whatever comes out on the other side. So, and I know, for you, like you started your own business, and like, you better be good and bring your clients over, right? Like, what was that part? That had to be a risk for you. And how did that go?
So I always talk about my family. Like, again, I had a really good support system. I still do. My family always owned, they're electricians. So literally my great grandfather was an electrician. My grandfather was, my dad was. They always owned water, heating, electrics. They always owned their own business. So I think early on I knew, well, I can't really work for anybody else. It's just not going to work for me. I've got a way that I want to do it. And it's, so I think early on there was that. But then at some point you're like, look, there is no other option. Like, this is what I'm doing. We're going to start it and we're just going to be successful. I had a wife when I first started and we didn't have kids yet. And I was just like, there's no way I'm going to fail. I may fail. I'm not afraid to fail, but I'm not going to let it stay there. I'm going to keep going. So if I do fail, I'm going to keep going and I'm just going to find ways to make it work. And it's just like over the last 2 years, it's like all these businesses have found that way to work, or, teams, sports teams, everything. You found out how you can work around the situation. So I think just being kind of stubborn in a way, knowing that I'm just never going to quit, and, just see enough successes early on that keeps you motivated, knowing that there is some validity in what you're doing. And you're like, I affected this one person. Let me just keep affecting one person at a time. And then the next person, and then you got a couple, and you're like, hey, I can do this. But the business side of it's completely different. Enjoying what I do, I'm really lucky. I feel like I'm really lucky to, again, have a good support system. So like surrounding myself with having good family and friends and things like that you can kind of lean on or cry. It's not easy all the time, but then, just pushing forward and knowing that I'm not going to stop. And I don't know where that comes from, but I don't know. It's maybe that is kind of ingrained. I just you enjoy what you do and you don't want anyone to take that away. So I don't know. That was a good answer.
No, I love it. I mean, I've known you, and you just were like, no, I'm doing this myself, and here's where I am, and we're going to live into it. I'm going to figure it out. But I knew you would be successful just because of your connection in a way with people. And I think that's a huge tribute to you, but also speaks to a larger point. It's so much more about relationships than anything else, right? And your ability to create relationships to connect with people. You're going to be a success in this world if you know how to do that. And,
I guess I did have 3 jobs in the beginning, just in case.
Yeah.
I was like, well, if this one doesn't work out, these other 2 will at least.
I got 2 more that can always work. Well, you can always go back to being a trainer, and right.
Nothing wrong with that.
Yeah, nothing wrong with that. That's good. The thing I think about too, my dad was a doctor. He was a family practice, and he had a way with people. And he always wanted to help people, but the thing I have the issue with doctors versus someone like you, like family practice. When I was growing up, if you had pain, it was just like, take this pill. If your shoulder hurts, don't go to practice, or just kick. And I think we found a better way now with, therapies and all those things like you did. So how do you, when people have injuries, your job is to keep them going, right? And when you think about that, is that the problem you're trying to solve?
Yeah, I think early on I used to say, and I still do, like when I look at somebody, I'm like, so for you, for instance, I'm like, my job is to keep you in business. I need you to keep your athletes in there in the pool swimming and winning. And it's, if I look at a trainer or coach, and I'm like, I need to keep you in business. I need to keep your athletes coming back. There's no excuse for me. Like, I hurt my back. Okay, where are we at? Can you get out of bed? Yes. Can you get on and off the toilet? Yes. Can you put your clothes on? So it's like, to me, there's no excuse, and there's always a workaround. So I help that person, that client work around their problem. Because you can always work around. You can lateralize. So like if they can't do this, they can do something next to this, or you can go up and down. So you find where they're at on that kind of spectrum, and then either go left or right or up or down in difficulty. But yeah, you need that. First off, there's a culture there. So you need to change the culture. Not the suck it up culture. If you have pain, I need to know about it, especially if it's early on. Let's fix it early so it doesn't get ingrained. But once there is an issue, you can't just stop. You can't just give up. It's not an easy pass to go home after school and not go to practice. There are things you can still accomplish, but a lot of times it's just seeing where that person is. I say there's the person that wants to get better, the person that doesn't want to get better, or the person that doesn't know. And the hardest one is the patient that has no idea if they want to get better or not. People are like, oh, the person that doesn't want to get better is hard. No, because you get them better and they can't not believe you. It's like, you're better. The person wants to get better. That's easy. That's you and me. We want to get better.
Right.
But then that third group that doesn't know, I think a lot of student athletes, if they're not super, super good, if they're not the top, if they're in the middle and they just get injured, they don't know if they really want to get better or not. They're like, well, this is my ticket out. And so, yeah, I kind of, with the different therapies we're doing nowadays, like we don't do a lot of ice anymore because that slows things down. We don't stop. We don't, after a back, if somebody has to have back surgery, we don't tell them to lay in bed for 3 weeks. We tell them, okay, you need to be up and moving today or tomorrow. You need to be after hip replacement, but we do that with injuries now too. There's just this mentality where get those patterns, reboot the system, if you have to lay in bed for a day because you can't move, that's one thing, but start moving, start doing things, do some breathing exercises, get things moving. But there's always a up, down, left or right that you can go from where you're at injured to let's keep moving.
Yeah. And that's the great attitude. And I think we're seeing that more and more, which is good. And we know that the human body is supposed to move. It's not just supposed to sit there and get all gelled up and locked down. Right. So, talk about we've talked about the breathing at Carmel a little bit, but the breathing techniques, and what are you seeing today in terms of the breathing, particularly with the slow breathing, the nasal breathing, and also the abdominal, like, what's the word I'm looking for that?
Belly breathing.
Belly breathing, yeah.
The bracing and breathing.
Bracing, that's right. The bracing.
Breathing 10 years ago was kind of like an outlier thing that, people, can they breathe? Yes, obviously they can breathe. We have a diaphragm that keeps us breathing. But a lot of times what we notice, especially if you've got that leaning forward posture and then your head comes up with cell phones, typing. I think we started seeing a lot more with typing. Your traps become overactive and you're breathing with your chest and your neck. And then we've seen there's been a lot of research with running and bonking and running and efficiency with, like, if you are breathing here, which that's a bodybuilder breath because you want to puff up your chest. But if you're breathing,
you're good at that, yeah.
Yeah, I'm good at that. My diaphragm doesn't work very well. But no, you're overworking all the overhead muscles basically. So if you have to use your upper body at all and you're breathing with those muscles, you get fatigued, you get injured, you get neck pain, you get back pain, you get shoulder pain, you get all these issues related to breathing. So I feel like, and then with the low back, that's just the upper back and the neck and the shoulders. But with the lower back, you've got stability because we used to think the core was just your abs or your transverse abdominis or your low back. Do some more extensions. Well, now we realize it's a ball. It's actually like a can with a top and a bottom. I think it's more of a ball, but you've got the side obliques, you've got the front and the back, and then you've got the diaphragm and the pelvic floor. And what we do is we pressurize that whole system and then it stabilizes the low back. And then that translates to everything. So if we can get breathing efficiency up and, stop using all these other things. Now there's reasons why we would take a big chest breath or hyperventilate or get rib mobility. There's other reasons why we would chest breathe and all these things. But in general, to be able to brace and breathe through the core and the stomach and the 360 kind of pattern, that's how we stabilize the entire body. And that's kind of where it starts. And if you watch kids and babies and watch them develop, the developmental growth through all the stages, the breathing always stays. It's the most fundamental piece that just they can brace and breathe without practicing. And we just lose it over time. And a lot of times it's being in positions, you're practicing sitting, you're not talking, and you're just looking at screens. And that's inevitable. We have to do those things. But trying to breathe, it's just, you're trying to alleviate some of those symptoms with the breathing. But then in the last 5 years, the research has been huge. A lot of the big names, Kelly Starrett was one of the first breathing guys in kind of that mainstream area. But you've got dynamic neuromuscular stabilization, DNS, which is a technique, Postural Restoration Institute, which is PRI, which is a technique. They all work. They're all very similar. And then you've got new stuff coming out with nose breathing, as far as being a parasympathetic, helps kind of shift workers, people that work at night. If you can run a mile with just breathing through your nose, it's scary as heck, but you can stimulate parasympathetic nervous system and relax. And there's some Wim Hof breathing. There's all this breathing stuff. What I'll tell you is focus on something to do with breathing and it works. So with athletes, it's more the core and the belly breathing. And the key with the belly breathing is just to be able to take a deep breath. And if you saw there, you can't even see my shoulders move, but I'm breathing all the way in through my stomach. Deep breath as opposed to, so
raising we can correct
that. Correct. Yeah. If we can correct that, you can go a long way into preventing and So preventing injury and rehabbing someone.
And that's that connection with the brain, right? Is that part of it?
Oh yeah, I mean, obviously, you know, the brain really controls everything. We forget if it's input or output, but it's both. But it's mostly output from the brain. I mean, even the eyes are connected. So yeah, if you're squatting, they used to say, look up to the ceiling. Well, what they mean is just eyes up, because as soon as you look down, your spine flexes. So literally, yeah, like everything's connected. And if you can train that belly breathing and bracing, get that like pattern to your brain. Okay, when I lift this, I brace and I'm able to breathe through that. You can, you know, repeat that, and you don't have to think about it. So I think with CrossFit, the big thing was like, they get to a point where they cannot push farther because they're breathing so heavy and so hard. So you have to retrain that. And it is almost like slowing down the brain a second, turn off the sympathetic, turn on the parasympathetic, so you can get everything to kind of calm down, control, and then keep going. Now with swimming, that's a whole nother thing as far as, I mean, I think we've talked about it, but as far as, you know, how do you push somebody to the limit and get their breathing? I mean, in water, it's so much different because you're not able to breathe anytime you want. It's a pattern and all these things. Anyway, I'm getting off topic.
Yeah, no, I think, you know, I trying to think about ways to control the breathing when they come to the wall in between repetitions. I don't think you're going to be able to nose breathe when you're swimming. I don't.
You can't nose breathe when you're swimming. Yeah.
No, I don't think that's going to happen. But you know, I know, like, I just talked with an athlete, and you know, in their warm up to swim before they got in, the coach put tape on their mouth, so they had to nose breathe when they warmed up. And I think they really like that. So I've been thinking about ways maybe just to stimulate that. We've talked about that before. I know the brace and breathe is something we work on continually, but
PRI uses balloons. They'll make you breathe into a balloon. So it's based around box breathing, I believe, which is a 5-second inhale, 5-second hold, 5-second exhale, 5-second hold. And that's like snipers will use that to slow down their heart and their breathing. And it's playing with the same thing in the brain. But yeah, I don't know if I'd tape the person's lips, but that's what they talk about. I think I've heard people tape their mouth. They go for a run and they have a panic attack and rip the tape off. And I'm like, I'm just going to keep my mouth closed. I'm just going to try it like this.
Well, you just walk around town with your mouth tape over your mouth, duct tape over your mouth, see what people say.
Yeah, exactly.
Yeah.
Just put a smiley face on the other side.
That's right. Let's finish up with some lighter questions, if you don't mind, today.
Okay.
All right. Okay. So you said, I doubt you kick in the pool. I'll just kind of ask you this. If you could go, I don't know, lift weights with anybody in the world at any time, who would you go lift weights with, Brian?
My wife, of course.
Oh my God. Anybody besides your wife? Come on, we got it.
She's the best though. She's so much fun to lift with. No, she'll listen to this. That's for her. Man, that's a good one. Man, Arnold
Schwarzenegger.
Yeah, Arnold. You know, I know he's been under some heat lately with some comments he said. I always tell people, remember the Arnold that got you into lifting, and that's who I want to lift with, because he has it. That Arnold is the Arnold that will always be there for me. Like, he's the one that's. So yeah, he's just, you know, he's a self-made guy and really motivating. But the old Arnold, not the new Arnold.
Okay. What 3 songs do you want to come on when you're in the weight room?
Man, what was it the other day? Hair down, dun, dun, dun. Good as hell with Lizzo. That song, feeling good as hell. Yeah. That's my pump-up song. What else? Man, those are really good. Any like Who's Bad by Michael Jackson.
Okay. Yeah.
And Man in the Mirror, I like those two, but Bad's like pump up. And then man, one more. Any Sublime song. I'm kind of like a Sublime. I like that kind of summer music is what I call it.
Summer music, yeah. Where were they from? Like the 90s, early 2000s.
Yeah, early 90s. Yeah. What would be your number one song?
I mean, to me, like before, I mean, I go just classic, but I mean, with Thunderstruck gets me going from AC/DC. Yeah.
I've been listening actually to Tame Impala lately. It's kind of a weird alternative band, but I guess it's one guy. It's called Tame Impala. I'll listen to that whole like Spotify playlist. That's what I listen to when I work out. But Lizzo, man, you can't go wrong with Lizzo.
All right. What song do you would you least like to pop up when you're in the weight room?
So this brings back a really interesting story. When I was at the YMCA, I was a manager before I was a trainer there, and I had an Olympic thrower that came in, and I'd let her in early. It was kind of, I wasn't supposed to, but I did, and I was like, just don't get me in trouble. But she'd come in and she'd throw, and she'd do like, so one day she was squatting like 3 something, and again, I grew up in a smaller town, and I didn't see a lot of women lifting weights, and now I know it's complete. My wife, it's amazing, but like back then it wasn't. So I was like, hey, what do you listen to? Like, you're lifting 300 something pounds. And she's like, Britney Spears, Toxic. And I was like, oh, her Toxic album. So I can't do it. I can't lift to, I don't know, any of the.
No Britney for you when you're in the weight room.
Nah, I respect it, but
Okay,
she could squat some serious weight with that Britney Spears playing.
Hey, man.
Can't do it. Can't do it.
Can't do it. If you could post a billboard in the weight room for everyone to see, what would it say?
There's so many things I want to say. Number one, just rack your weights.
Rack your weights. Put your weights away.
Please, right? Just rack your weights. It's part of the workout. Literally,
right.
It's part of the workout.
Exactly.
I stopped racking my weights. Well, I had a surgery once, and I couldn't rack weights. That was my job once. I was a monitor at Ball State, and I racked weights. I stopped doing that, and I got so weak. I was like, this is a huge part of the workout. Just rack the weights.
Put them back.
Rack your weights.
Okay.
But
good.
Get off your phone.
Get off your phone.
Right? On the machine. Yeah. Get off your phone. Let me work in. Hey, let me work in.
Yeah. What for the people out there, what do you want to finish with, and then like where can they reach you at?
Yeah, the easiest thing is obviously our website, indiemuscle.com. That tells you a lot about myself, Dr. Alec Domian, and we've got 2 massage therapists. And it's just it tells you a lot about what we do and all the different modalities. I know we threw out ART, Graston, dry needling, acupuncture, DNS, McKinsey. It's all on our website. It tells you everything about it. I know everybody mostly has social media. Dr. Brian Waters on Instagram or Indie Muscle and Joint on Instagram. Those are good places. We keep those up to date. So indiemuscle.com or social media, Dr. Brian Waters or Indie Muscle and Joint.
Well, thank you, Dr. Waters. I appreciate
it.
Yep. When's your next competition?
5 years.
You're done bodybuilding?
I've got to gain some serious weight. I got my pro card at 154 and I've got to compete at 212 now. So I competed my first pro show this year at Classic Physique. So it's 180 based on my height, but I've outgrown that. So I'm about 215 now. I need to get up probably 230, 240 in the off season. That's tough. That's a lot of food. So
a lot of food.
2 years. I'll be a dad and a doctor for a while, and then I'll get back into that. But people are like, oh, so you're gonna take time off? No, I'll still lift and eat. I just can't compete for a while. I mean, I could, but it wouldn't be fun.
Right. All right, this has been fun. Appreciate you jumping on, and thanks.
All right, appreciate you. See ya.